As earlier mentioned, one of the most comprehensive HIV surveys ever conducted in Kenya is underway. Those on the ground tell us that some people are still uneasy about opening up and taking part in this survey. Tonight, we get to hear from those at the heart of the survey who tell us there's nothing to worry about and there is more for the country to gain from this survey. Joining me once again, Dr. Joyce Wamishwe, the Program Manager for Strategic Information at NASCOP, and Nelson Otuoma from the Network of People Living with HIV. Thanks very much once again for your time. Daktari, we had started with you on the aim of this survey.
Yes. So the survey is the third of its kind in this country, and it stands for Kenya Population-Based HIV Impact Assessment Survey. And it's a household-based survey, and we hope to understand where are we at when it comes to HIV programming. And once we understand, we are going to be able to plan for the future. We intend to be one of the countries that hopes to achieve the UN goals for 2030 for epidemic control. And we need to know whether we are doing the right thing, or do we need to change where we are investing? Who are the populations that are at greatest risk? Are they accessing the services, the prevention, care and treatment services? So really the survey is to tell us where are we at, and then what do we need to do to get to epidemic control in 2030?
And Nelson, to you, reactions from Kenyans. Like I mentioned in my intro, there are those who are very uneasy about opening up and taking part in the survey. What has your experience been on the ground?
Thank you. And for us, I've said I work at NEFAC. We are there, we are civil society and communities, and we work and support the KenFIA survey, and we support NASCOP in this survey because there's an assurance that testing is on consent. If you agree, your result is confidential to you and the privacy is maintained. Now, where we have gone, I think some people have not gotten the information, but when we come to a household, like your earlier question, we introduce ourselves, we educate you on the importance of KenFIA and the importance of you knowing your status, and it is your choice to decide whether you want to be in the survey. And even if you are tested, for those who accept, your result is not communicated in front of everybody, and you can choose within the home state where you want to be tested. But what is important for us is that this is voluntary, but we visit you in the home. It is like the hospital coming, because it is not just about HIV. The HIV is a entry point, but we can do assessment. If you have a cold, we can advise, and then you are referred. You may have malaria, then we can help refer. And remember, one of the conditions being tested is like sexually transmitted diseases like syphilis. And if that is through screening is gotten, we refer you immediately to a nearby health facility. But your results will remain confidential and private.
So on a range of 1 to 10, how many people are actually agreeing to get tested?
This is the second week of KenFIA, and quite a good number have responded well. We have met people who have questions, not that they are rejecting, but they have questions. We also encourage questions so that before you enroll into the survey and you are tested, your questions are responded to. Yes.
To you, Dr. Joyce, how to reassure people that they will not be victimized? This is a survey essentially, and you're looking at the numbers, you're looking at the current prevalence. So in terms of the positive outcomes, how should people, how should people react to you guys coming into their homes, and how confident can they be in the fact that their results will actually not lead to stigma or victimization of any sort?
Yes, that's a very good question. So we've done a lot, beginning from how we are mobilizing communities to get to understand what is KenFIA. We really are saying don't fear KenFIA. It's there, it's for Kenyans, and it's for us to take part in it so that we are able to assist the Ministry of Health get to understand what we need to do better. But the other thing we are also doing, we have trained our teams to ensure that at all times there is privacy when you're dealing with the respondent. And even when the test is being done, as my colleague Nelson has said, it is done at a space where you are comfortable and nobody else is there. Yes, we do have counselors, and they do the pre and the post-test counseling. And then for the survey component, once we take you through the consenting and you do agree to take part in the survey, we get your details, but at the end of the day, your details like name are not part of the data set. The minute we identify that you're a unique person, we give you a unique survey ID, and that is what you are known as throughout the survey.
And now this survey is being carried out in the wake of the HIV self-testing kit. Wouldn't this then be an impediment to your survey? The fact that people might actually find it easier or might be more comfortable with actually testing themselves as opposed to having medics come into their homes and carry out this procedure. Nelson?
No, I think the convenience of visiting homes also equals the convenience of getting a testing kit. But the most important point is that we may go to a home where somebody has been tested. We would still request that we run a test and request for sample for further analysis, because it is not just about HIV status. For those who are HIV positive, there's what we call viral suppression. So that is done through finer and further analysis. The choice really...
So people who actually communicate to you that they have already been tested and are aware that they are HIV positive are still being
we will still
sampled
request
in the survey.
Yes, they are still because we go to a household, and when we communicate to us, we also don't communicate to other people in the household that you have actually been tested and you are positive. But the point really is that this is a choice. You can make a choice. You know, HIV self-testing is a screening. After this done, you are referred to a facility. Even us who are going through the CanFIA survey, we will test you, but it does not end there. We will refer you to a facility. So it is a mix, it is complementing. But because this is going to give us a really scientific result, we are encouraging people, even those who know their status, even those who can access self-testing, to still volunteer to help, because it is more than that, because it is like a health check, all a health check within your body.
The current burden of the disease in terms of numbers, where are we at?
So we estimate we have 1.5 million people living with HIV in this country, and of this we have about 1.1 million who are on antiretroviral therapy. And of course, for you to be on ART, you need to have tested and been identified as HIV infected. So the gap, the 400,000, is really Kenyans who maybe have been tested and they were identified as positive but are yet to be linked to care, though of course we anticipate that that is a small proportion because our linkage to care is quite high. But there is also the Kenyans who are yet to be tested. They don't know their status, so they are out there, but they are yet to get to, because it all starts with knowing your status.
The current prevalence in terms of new infections and ages. Yes,
so in terms of the prevalence, the country prevalence is at 5.6%, but in terms of new HIV infections, we estimate about 77,000 per annum, and of this, majority, quite a big proportion, is amongst the adolescents and the young people, the 15 to 24 years.
What do you attribute this to?
There are many possible reasons for...
You said 15 to 25?
Yeah, 15 to 24 years.
Wow.
Yes.
Okay.
There are many possible reasons, but what we are seeing is the way we used to look at HIV earlier, when it was just getting into the country, we don't see a lot of communication messages. So this particular age group does not seem to view HIV the way we used to view it. Things to do with behavior change, things to do with use of condoms, and even things, simple things like knowledge of status. I mean, it all starts with knowing your status. The people who don't know their status are the people who should be worried.
Right.
Yes.
And finally, Nelson, to you, how long is this survey going on for? What should people expect in terms of who will be paying these visits to their homes? What areas specifically are you carrying out the survey?
The survey was originally designed to run for 6 months. However, depending on how it goes, we will adjust accordingly. But as Dr. Wamishu has explained, this is a team. There's a team of community volunteers who are helping us to identify homes and that have been sampled and to mobilize communities. And we may also work with government officials like Assistant Chief. But their role is just to tell you, your home you are looking for, this is the home. But
so
now
you're not looking at, for instance, low-income areas, middle-class areas, in the suburbs.
We want this to be a Kenyan survey for Kenyans.
Okay.
So whether you are in Kitusuri or in Kibera, or whether you are in Malaba or Malindi, if you are sampled, you qualify to be the survey.
Yes.
But when the team comes, this is a team that will be doing the survey. We have counselors, we have clinicians, we have lab people who do laboratory work for the actual testing. And that is the team that is there. They introduce themselves. Normally, if people come to your place, they have to introduce themselves, and I expect you to introduce yourself if you consent. They will explain the details of what KenFIA is and why, and explain to you the people in the household that they would request to accept and consent, that they sign that they want to be part of the study, and the benefits, and they also tell you the risk. The risk can be minimal, like if they do a break here or a blood draw, you may feel some pain, but that is the minimal risk. But the benefit is that people are going to understand HIV in Kenya. Those who already are positive will be referred and linked immediately to treatment, and those who are on treatment will be monitored so that we see how the virus is being suppressed in them.
Right, and I thank you so much for your time. We've been talking to Dr. Joyce Wameshwe and Nelson Otwoma. Many thanks.
Thank you.
In other news, Muslim faithful assembled across the world in celebrations of Eid to mark the end of the holy month of Ramadan. Here in Nairobi, Muslims gathered at Sir Ali grounds for prayers. Muslim leaders marked the day with messages of peace and accountability in the running of public affairs.
They converged at various mosques all over the world for special prayers on this day ahead of special meals and interaction sessions with friends and family. In Kenya, Muslims in Nairobi trooped to Sir Ali grounds to mark this special day with prayers. Ibrahim Masuli, a Muslim faithful, says Eid al-Fitr means the beginning of breaking the fast. He says charity is given to the poor on the day to recount the holy month of Ramadan.
After fasting for 30 days, you come together and celebrate together by eating. So basically it's about family thing, coming together, bringing up neighbors and people from different backgrounds so that you can celebrate together.
National Assembly Leader of Majority Eden Dwale said this day is meant to bring all Muslims and non-Muslims together.
Those of us in our community who get involved in issues that are against